Our next speaker is Dr. Kevin Tan. He's an endocrinologist in private practice and an expert in diabetes. And he runs his own practice at Mount Alvernia Hospital and Mount Elizabeth Hospital. He is currently the Vice President of the Diabetic Society of Singapore and a life member of the society. And he chairs the Diabetes Education Subcommittee and sits on the Accreditation Board of Diabetes Nurse Educators. And he has also been chairing the organizing committee of the World Diabetes Day Singapore events since 1998. His topic today is understanding your diabetic medications. May I welcome Dr. Kevin Tan?
Thanks, Dr. Tan, and I want to thank KDF for inviting me here to share in this occasion with you. I also want to congratulate KDF on its great work in treating people with kidney disease and more importantly, in spreading the awareness of kidney disease prevention. And so I hope that you all will take home with you some messages and share it with people who are not here, for I'm sure there are a lot of people who would likewise want to know what we talked about today. So understanding diabetes medication, you would probably look at it as another way which I hear from my patients, why do I need to take medication for diabetes? So I'm trying to answer the same question worded in a different way. So why take your diabetes medication? In a nutshell, it's because, as you've heard, diabetes is associated with a lot of complications. Managing diabetes well can reduce or prevent or push back these complications. I want to highlight that although we are emphasizing kidney disease here and kidney failure as a worrying diabetes complication, diabetes can cause a lot of complications. There's a lot of suffering in diabetes that we always talk about. A person can go blind as a result of poorly controlled diabetes. You've heard that if you survey the people in the dialysis centers, more than half of them have diabetes and are there because of diabetes. The sad fact is that with all the suffering that comes with diabetes, the majority of people with diabetes die. They die from heart attacks and stroke, what we call large vessel complications of diabetes. Diabetes is also responsible for people losing their feet. What you may see here is a statistic that was maybe about 5 years ago. 700 people in a year lose their feet to diabetes. That's 2 every day. Happily, less people lose their feet to diabetes now, about 200 a year. And this shows how well it can be prevented if you know how to look after your feet and prevent this complication. And then if that doesn't scare you enough, men are scared by how diabetes affects them in terms of impotence. And in women, diabetes can also cause a lot of pregnancy complications. So a lot of problems with diabetes. But there's always good news behind it, and the good news is that good sugar control, actually it's good sugar control linked with good blood pressure control and good cholesterol control can reduce these complications. And you can see the statistics here, the numbers here from big diabetes trials. You can actually reduce these complications if you control your diabetes well by between 15 to a third to 33%. But it's difficult, it's not easy to do that, that's the problem. To achieve a good sugar control, you need a correct balance. And the correct balance is not just medication that you see on one side of the scale here, but it's also lifestyle measures that we nag our patients about and they find so difficult to follow, and it is indeed difficult to follow. It includes weight reduction if a person is overweight, regular exercise to help to reduce weight and also to make the insulin in the body function more efficiently, as well as diet control, watching the food that you eat, which you will hear more later. So it needs the correct balance of both. You can't do without one arm of the scale. You can't just take your medication and not do anything to your lifestyle. Nor can you say that I want to just control my lifestyle and I try to be without medication for diabetes, because you need a balance of both to have good or optimal glycemia, which is blood sugar control. Not only that, but even the big associations come up with this idea. By a joint statement from the American Diabetes Association, it says here, if you read it, and I'll read it to you, that there's limited long-term success of lifestyle programs to maintain a good sugar control in the body in type 2 diabetes. And that is why a majority of people, sooner or later, would need diabetes medication to help them control their diabetes. So you've heard, why is medication necessary? It's necessary because the lifestyle measures are very difficult to follow, are very difficult to maintain over the course of your life in the control of diabetes, and so you need the help of diabetes medication. Another reason why you need diabetes medication is that diabetes is a complex condition. There are just too many things that go wrong with diabetes, and I'll attempt to show this to you in this slide. This is what Dr. Chu showed a little bit earlier, but shown in a different fashion. The carbohydrates in the stomach are metabolized, are broken down to sugar, and this forms sugar in the blood. It stimulates the pancreas to produce insulin, and there's another hormone called glucagon that goes down. At the same time, there's a direct connection from the intestinal cells to the pancreas, what we call incretin hormones, that cause also the pancreas to produce insulin and to shut off production of the other hormone, glucagon. And this helps sugar to be absorbed in the body. It helps it to be absorbed in the fat, in the muscle, and in the liver. And this is the interplay of two very crucial hormones in diabetes. Insulin on the one hand, you see here, and the other hormone called glucagon. And insulin brings down blood sugar, and glucagon raises blood sugar. And so this is what you see in this slide, what I said about what happens normally in a person without diabetes after a meal. But what goes wrong in type 2 diabetes? In type 2 diabetes, the pancreas doesn't function very well, and because of that, there's lack of insulin in the body, or the insulin doesn't work. At the same time, at the sites of the liver, the muscle, and the fat, the insulin does not do its action in opening the door for the sugar to go into the cells to provide energy. What we call insulin insensitivity, insulin resistance, or insulin ineffectiveness. So the combination of that, as well as another factor, which is that the incretin hormones that is produced by the intestine cells are also defective, all these lead to the problems in type 2 diabetes. So all you need to know is that it's a very complex condition, many things go wrong. And so it's too simplistic to think that just by watching your diet, and watching your diet just affects how the carbohydrates go into the body, can address this very complex situation that happens in diabetes. And because of that, you need the different medication, the diabetes medicine that is available to help you control your condition, in addition to lifestyle measures to control your blood sugar. Let me just try to go through some of these medications to you. Some of it may seem familiar to you, and you would identify with that, whereas others may not be familiar to you, probably because if you have diabetes, the doctor hasn't started you on that, but it's still good for you to know. There is acarbose, glucobay. It is a sort of, it's not a carbohydrate blocker. Well, I'll tell you each of the medication in turn, but you can see here how the medication act at the different things that go wrong in diabetes. So you have acarbose acting on the stomach, preventing the sugar from going too rapidly into the intestine. You have the insulin secretors called sulfonylureas. You have a group of medicine that we can't pronounce, and so we call it for short the TZDs that act on the fat and the muscle tissue. You have a very good and old diabetes medication under the class of biguanides, and then you have medication that helps the effectiveness in the incretin effect on the pancreas. And so that is why the doctor may combine medication for you. He may give you a medicine here to combine with a medicine here, or he may give you this medication to combine with this, and that's why you may end up with 2 or 3 different sorts of medication to control your diabetes, because they all hit diabetes at the different areas where it goes wrong. So let me tell you a little bit about the medication. Acarbose, which you know as glucobay, it slows down the sugar absorption in the body. It's not really a carbohydrate blocker because the sugar still goes into the body, but it doesn't peak as fast as it would normally be. But for glucobay and for any other diabetes medication to be effective, you need to take it the right way. And so glucobay or acarbose needs to be taken with the first bite of each meal, and when you do this, it will slow down the sugar absorption in the body. If the doctor starts you at too high a dose of glucobay or acarbose, you may get some diarrhea, some churning, some gas in the stomach. But this can be simply remedied if you cut down your dose or you start it off very slowly. So this is what it looks like, glucobay. The next group of medicine is very familiar to all of you. You call it the sulfonylureas or the insulin secretors. It acts on the pancreas and it makes the pancreas produce more insulin. And some of the tablets you might be familiar with are listed over here. And this is how some of the tablets look like. The sulfonylureas, because they stimulate the pancreas to produce insulin, they again have to be taken properly. You have to take the medication about 20 minutes before the meal, because you must give the medication time to enter into the body to stimulate the pancreas to produce insulin before you start eating. So if you're in a hurry to eat and you take the sulfonylureas either during the meal or after the meal, then you have a mismatch of the working and the action of the drugs and you don't get the desired effects. The tablets are very strong, and that is why it can cause low blood sugar, especially if you don't eat the meal. So whenever you have your meal, then take the tablets. If you don't eat, do not take the tablets. Sulfonylureas, also because they stimulate insulin, they can cause a certain amount of weight gain. As I said, there's another group of tablets that you see at the bottom here, and these are called the DZDs. You may have been familiar with an older drug called Avandia, which is hardly used now, but a newer counterpart of Avandia that is still on the market is called Actos. You see it over here, and what the drug does is that it works on the muscle to to make insulin more effective at the muscle and the fat tissue. So it is what we call an insulin sensitizer. It makes the insulin more effective in its action to allow the sugar into these cells. There's another group of tablets here that most people with diabetes are on because it is a very old medication and it's very safe to use. It comes under the class of biguanides and it's called metformin or glucophage. It is again an insulin sensitizer like the TZDs that you heard before, but it acts mainly on the sugar, on the liver, to shut off the liver production of sugar. Metformin for tolerance is better taken after a meal, and so you agree better with it and that way. If you take too high a dose of metformin, again you can cause some stomach discomfort, some diarrhea, some gas, which some people enjoy having, but a lot of people don't, and that's why the dose has to be watched. But saying that, glucophage or metformin is a very tried and tested medication. It's as natural as you can get. The metformin's use around the world is more than 50 years. And those of you who want something natural, this is as natural as you can get in terms of Western medicine, because metformin was actually derived from the French lilac, and so it's actually a plant-based medication. A new group of medication that some of you may have heard about comes either in the name of the GLP-1 analogs or the DPP-4 inhibitors. They are a mix of tablets and injectables. So some of them have to be injected, some of them can be taken orally. They all work on this reduced incretin effect, which I told you is a hormone that's produced by the intestine cells and that tells the pancreas to produce more insulin and to shut off glucagon production. Pretty good tablets. There's no side effects actually to warn you about, and so it's pretty well tolerated. It doesn't cause the bad things that some of us associate with some of the diabetes medicine, like plummeting your blood sugar or causing weight gain, and especially the injectables, and you might hear some of it over the next few months because a new injectable is being launched in the next few months. These can actually cause weight loss in diabetes, and that's something that we've been all waiting about because for most diabetes medicine, it either causes you to gain a little bit of weight or it's weight neutral, but hardly anything except for these new injectables can cause weight loss. And so you have it, these are all the different oral medication that a person with diabetes can be on, and again it says there's no duplication. They all work on different parts of the diabetes problem, and so your doctor can put you on a single tablet, on a combination of 2 or 3 tablets. But right here at the bottom of the list you see something else. You see insulin, and of course insulin is the other medication that we also need to talk about. And whereas all the oral agents that you heard about have an indirect action, they either have to go through the pancreas or they have to act on the muscle or the liver to lower blood sugar. In the end, the result is the same, of lowering of blood sugar. But if you talk about insulin, insulin is direct and to the point.